This article is titled, Financing Transformative Health Systems Towards Achievement of the Health Sustainable Development Goals, a Model for Projected Resource Needs in 67 Low-Income and Middle-Income Countries, and was authored by Karen Stenberg, Master of Science, Odhan Sen, Master of Science, Tessa Tantorres Ediger, Master of Science, Melanie Bertram, PhD, Callum Brindley, BEcom, and others.
No estimates of the additional resources needed to strengthen comprehensive health service delivery towards the attainment of SDG 3 and universal health coverage in low-income and middle-income countries have been published. We developed a framework for health systems strengthening, within which population-level and individual-level health service coverage is gradually scaled up over time. We considered for service delivery platforms, and modeled two scenarios with differing levels of ambition: a progress scenario, in which countries' advancement towards global targets is constrained by their health system's assumed absorptive capacity, and an ambitious scenario, in which most countries attain the global targets. We estimate that an additional $74 billion spending on health is needed per year by 2030 to make progress towards the SDG 3 targets, progress scenario, whereas $71 billion would be needed to reach health system targets in the ambitious equivalent of an additional 1 or 8 per person, respectively, by the final years of scale-up. In the ambitious scenario, total healthcare spending would increase to a population-weighted mean of 71 per person across country contexts, and the share of gross domestic product spent on health would increase to a mean of 7.5%. Around 75% of costs are for health systems, with health workforce and infrastructure, including medical equipment, as the main cost drivers. All countries will need to strengthen investments in health systems to expand service provision in order to reach SDG 3 health targets, but even the poorest can reach some level of universality. In view of anticipated resource constraints, each country will need to prioritize equitably, plan strategically, and cost realistically its own path towards SDG 3 and universal health coverage.
We are article.tv. Links in the description below.